my sit up tall, though.
No, I'm okay.
Oh, so you're going to do the intro, and we're just going to go right into it when it ends, right?
Yeah. Welcome to the Mold Matters podcast. Whether you are looking for help recovering from mold illness or just want to learn more about creating a safe environment for your family, this podcast is the place for you.
Hello, everyone. Welcome to Mold Matters, the podcast. I'm your co-host, Jeremy Evans, with
Mike Adams. Good to be with you.
Good to be with everybody. Yeah,
it's been a while.
It has been a while.
Yeah.
We say that every week because we kind of get caught up in life, and then we.
Well, I had to get a new body part, Jer.
Oh, that's true. We have an excuse.
Yeah, I have a new right knee.
Yeah. Do you have to go through metal detectors? Do you have to tell them now?
I don't know. I'll find out Tuesday, I guess.
That's true. You're flying out. Well, yeah. So you're feeling better? Feeling okay?
Feeling great. Yeah.
Okay.
It needed to be done.
Yeah.
Yeah.
Good enough to do a podcast?
Absolutely.
Okay.
Yeah, ready to go.
Well, let's get rolling. Today we're gonna talk about an aspect of mold testing that we get asked about and people ask about a lot in general. It's the ERMI and the HERTSMI tests. We mentioned it briefly when we did a podcast on mold testing back, about a year ago. And we kind of just briefly talked about them, but we thought we'd do a deeper dive into the ERMI and the HERTSMI today and maybe talk about the pros and cons. We very distinctly talked about pros and cons of all testing methods back in the day. And truly, there are always pros and cons of any testing method, right?
Right, of everything, yeah. It's I give the same little talk every time I talk to somebody about testing. It's a tool, and that's all it is a tool. Mm-hmm. Use it with a great big, bottle of common sense.
Yeah.
When you look at it.
Yeah, and the ERMI and HERTSMI are no exception.
Right.
I mean, there's pros and cons, and so I think always understanding the pros and cons is helpful because when you go into an inspection or an assessment, you want to know if I'm doing this test, what am I going to have to deal with as far as cons go?
Yeah, and I see it all the time where I'll get a call and the mold professional will say, "What do I do?" Their doctor wants an ERMI test.
Yeah.
And they know how to do the test, but they don't understand how to interpret it. They don't even understand what the ERMI test is for sure. So
yeah,
it's important to understand all the aspects of the ERMI, what it can tell you, what it won't tell you, and like I say, just use it as a tool, but it's not a definitive guide of what's going on in the home.
Yeah. With that intro, what is the ERMI test, Mike? Tell us.
Well, ERMI.
Answer the question.
Yeah, ERMI stands for Environmental Relative Moldiness Index, ERMI.
Yeah.
So right around 2004, 2005, I believe, the EPA, along with HUD, or the Housing and Urban Development, they kind of set out to do some testing. They wanted to determine what is an average home relative to mold, hence the name Environmental Relative Moldiness Index.
And they made up the word moldiness, we're pretty sure.
Pretty sure, yeah.
Yeah.
Anyway, so they went to a number of houses, over 1,000 homes, and I think it's like Kansas, San Diego, and Boston, and took dust samples. And with these dust samples, they took the dust back to the lab, ran what they call a polymerase chain reaction or a PCR test.
Is that what they're doing with COVID? Similar deal?
Exactly. Yeah.
Okay.
And with that, they can determine the DNA of the mold and know the exact genus of the mold.
Yeah.
So it's funny because they were trying to establish, okay, what is a moldy home versus what is an average home. They kind of ended up dividing it into 4 different quadrants. And then you remember during this time, about 2004, 2005, that's about when Richie Shoemaker published his first book. We all know Richie Shoemaker's kind of the pioneer of doctors studying mold.
Mm-hmm.
And so it became kind of a hot topic.
Yeah.
And then Shoemaker came along and was instrumental in developing the HERTSMI test.
Right.
So the ERMI, oh, go ahead. I'm sorry.
Which he kind of stole the ERMI model and adapted it essentially.
Stealing's a rough word. Yeah.
Yeah.
Borrowed.
Borrowed. Yeah.
Anyway, the ERMI test for, correct me if I'm wrong, Jeremy, 25 molds?
26.
26, okay. Yeah. And the HERTSMI, it's much more affordable, only tests for 5 molds.
Yeah. ERMI 26, I should say 26 of what are considered water damage.
Water damage,
molds,
dangerous type molds.
And then 10 additional.
Right.
For a total of 36, 10 additional that are considered, I don't know, what are they, common indoor molds?
Common indoor molds that they consider fairly safe.
Yeah.
Yeah. So what they do is, well, let me explain how they run an ERMI test first. Is it used to be where they would sell you it's a little cassette that hooks onto a vacuum, and they wanted you to vacuum, I think 3 feet by 6 foot area, one in the living room and one in the master bedroom off the carpet.
Yeah.
That gave them enough dust to be able to run these PCR tests. Later on in the later 2000s, 2007, 8, more and more people started getting rid of carpet and going to hardwood floor. So they brought in Swiffer wipes and started collecting the dust on Swiffer wipes. And that's that alone is a little bit controversial, because I've talked to guys who are pretty up to speed on all this stuff, and they're like, wait a minute, we don't even know where that Swiffer wipe has been in the store. It could have been picked up mold in the store. It's made out of cotton. It could have mold DNA from the cotton field.
Yeah.
We just don't know.
Yeah, for sure.
So it's a little bit controversial, the whole Swiffer wipe thing. But by and large, it gives you a general idea on if the home is safe or not safe.
Yeah. So you collect some dust samples.
Collect some dust samples. Yeah.
And then so they measure some some toxic, harmful molds and some common molds. Maybe get into the scoring a little bit, because I think that's controversial too. The way they score it doesn't. I think there's some issues there. If you want to address those.
Yeah. The first analogy I thought of is kind of like a cholesterol test, where you've got good cholesterol and you've got bad cholesterol. Like for my personal case, I have good cholesterol, so my doctor doesn't even worry about how much bad cholesterol I have. He says it outweighs it, you're fine.
Mm-hmm.
It's a little bit like that. So what the ERMI, the way they scored is, if you say you collect, this is just a number off the top of my head, 27,000 spores of bad mold, and you collect, say, 30,000 of good mold. Now, these are just made up numbers, but just to give you an idea, that house may score fine, right? Because the good mold offsets the bad mold.
I see.
Now, if you have house B that only has 172 bad molds and 300 good molds, that house is, they're going to say that house is fine. But if you compare the two, you would say, no, wait a minute, that first house that had all that bad mold,
thousands and
thousands, how can that be as safe as that second house?
Right.
It doesn't make sense to me at all. So.
Yeah, and I think the idea was, they group them into group 1 molds. Those are the harmful ones. Group 2 molds are the common indoor molds. And they figure the common indoor molds, you don't see those as much, when there's a water damage issue, but you see these other ones elevate. So there should be kind of an incongruence. There should be a larger amount of those harmful molds and less of the common molds. But I would say, I'm thinking of even a fairly recent job where there was mold all over the place, and I think I just did a tape lift, like a surface sample. And I kind of looked at it, and I think it was kind of black and some green, and in my mind I thought, that's probably, it could be Stachy, it could be like some penicillium or aspergillus, I don't know. I wasn't sure. Maybe Chaetomium, who knows. I get it back, cladosporium.
Wow.
It was cladosporium.
Yeah.
I've had a few, not a lot, but I've had a few where I get the test results back expecting these really nasty molds, and it's just an elevated, cladosporium or one of these kind of known as common indoor molds.
Fairly safe molds, yeah.
Yeah. So I think you do run the risk of, missing some mold scenarios if you just go off of their scoring system.
Yeah. Now, I have read some reports where they've compared testing carpets versus testing with the Swiffer duster.
Mm-hmm.
And it seems like if you're in that dangerous quadrant, they're fairly consistent, whether you use the carpet test or the Swiffer duster test.
Yeah.
That seems fairly consistent
Yeah.
to be a really, really dangerous home. But if you're a home that's on the bubble, you can have wild variations of the results
Yeah.
with those.
So the it's basically is it a percentile ranking? Am I thinking correctly? Of all the homes they've tested, if you're in a level 4, which are the really bad homes, is kind of the 75th percentile.
Yeah, the 25% worst homes out there.
25% worst homes out there.
Yeah.
So, yeah, and then the middle quadrants, like you're saying, is the middle 50% chunk, and that can be, I mean, that's what you're saying. That's where the danger zone especially is, I think.
Yeah.
And then, you think of, I've heard from others where I even read some studies how, we commonly do visual inspections and, smelling, we'll smell and visual. And I've seen some incongruence there where an inspector determines a mold issue and the ERMI didn't. And then ERMI determined a mold issue and the inspector didn't. And so I think it'd be nice if we could pull out the inspector out of the equation, but every time I ever get into this, it all comes down to you have to have a good inspector to interpret the results.
Well, even the EPA, they made two different statements on the ERMI. One is this was for research purposes only, and so do not use the ERMI as a definitive test to determine the healthiness of your home relative to mold.
Yeah.
And the other thing that the EPA said about it was, now I lost my train of thought. I do this every time. It'll come back to me. Just give me a sec.
I'm just buttressing your point here. Yeah. We read it right before this website as kind of a preparation, but if you go to the EPA's website, the question says, should I use the ERMI for mold investigations? And
big
no. Big NO.
Oh, the other thing is that the other thing that came back to me now is you need to understand that when you do an ERMI test to evaluate the healthiness of a home, you may be getting DNA from 75 years ago.
Yeah.
That's a 100-year-old home.
Yeah.
So it gives you, I guess the best way to look at an ERMI test is it gives you a really good history of the overall mold load of your home, but it doesn't give you great real-time information.
Yeah, I can agree with that. Yeah. And there's a lot of factors that can affect that too. Like we talked, if you have brand new carpet in the home and you're taking a carpet sample, there's kind of a debate out there whether cleaning the home really well will affect the ERMI because you're cleaning up all the dust.
Well, I actually read another article right before this podcast where a guy was saying, look, sometimes the harder we try to pass an ERMI test by cleaning the home, the worse my ERMI score gets because you are cleaning up the good mold, or what they call the okay mold.
Yeah.
If you clean that all up, then your ERMI score could be worse, but it's actually a cleaner home.
Yeah. Yeah. You're affecting the score. Yeah. And then another topic I think we should bring up is using ERMI as a post-remediation tool. Whether you're doing the traditional model or whether you're doing some other methods, I don't think, even the best, most thorough remediators out there kind of look at it as not the best post-remediation tool. I don't know. What are your thoughts?
Yeah. In fact, I've read a lot of articles where traditional remediators have written articles and kind of slammed the ERMI. Mm-hmm. And part of the problem is the ERMI suggests that you take a test in the living room and the master bedroom. Well, what if the traditional mold remediator did all his containment and his work in the basement, right? He's not going to touch the rest of the house, so how could an ERMI test give him any idea of how he did in that basement? Yeah. Now, from our standpoint, we believe that the entire house needs to be addressed, not just where the mold, they see the mold or where the moisture was. So, I don't know how it falls into place for traditional remediation at all, unless it's a company that just goes through and wipes down everything in the entire house. Or, we treat we don't wipe down the entire house, but we treat the entire house. One thing you have to be aware of is that if you completely denature the mold, but don't wipe it up, the DNA will still be there.
Yeah.
So you can have a completely safe house, denatured, what we call nothingness, or inert nothingness, but the DNA is going to be there.
Yeah.
So it's going to be hard to show a good ERMI test after like our type of treatment. And
Yeah.
I've had many talks with doctors, and I always explain it to them. Look, the DNA is going to remain after we're done, and I've never had an issue with a doctor saying I don't buy that at all. They always understand it.
Yeah.
And the real test is, does the person start feeling better anyway?
Yeah. Yeah, I've also heard the argument of, okay, I'm going to vacuum up big swaths of carpet, and then on the post-test, I don't have much carpet to vacuum anymore. I do know some guys will do maybe less square footage.
Just a little bit of carpet right here.
Yeah. Yeah, they'll do less square footage but more rooms. There's different ways to go about it.
And you told me how the test reads when they do that. It comes back just non-conclusive? Or?
Yeah, if they don't get enough dust. Yeah. And actually, some labs, they'll still run their equation, their algorithm, even if you don't get the threshold of minimum dust. And then it really throws off their equation. Sure. And then it looks like there's a huge problem or there's not a problem at all.
Yeah.
But there is a minimum threshold of dust for the actual algorithm to operate. Yeah. And if you don't collect enough, they'll just send you a report and say, inconclusive results, not enough dust collected. And anyways, I just heard that some remediators like that, because then they say, all right, your house is good on a post-remediation because there's not enough dust. We got it.
See you guys later. Well, we have Dr. Jeff Wright on our staff.
Yeah.
And he talks about the ERMI all the time. And he said, it's the top, bunch of molds that they test for. But what if my patient is reacting to the one that's not on the list?
Yeah.
So he's the same way. It's a tool, but he's not going to make a definitive decision on the health of that patient based on an ERMI test.
Yeah. So. And unless you want to say anything else about ERMI, let's broach a HERTSMI test real quick.
Yeah.
And I've, in all these years, I've always known, ERMI, Environmental Relative Moldiness Index. I think, that's easy to remember. I never really knew what HERTSMI stood for. Have you ever heard?
Jerry, I got to be honest, I still don't know what it stands for.
Well, I had to look it up because I'm like, what is it? I got to tell on the podcast. So, well, I did know this. I think they created the acronym so that it, what kind of molds hurts me. That's where they tried to get it to match that.
I like that.
So I did know that part, but here's what it really stands for. Health effects roster type specific of mycotoxins and inflammagens. It sounds like they were really trying to fit that. Anyways, so basically, as Mike mentioned, the HERTSMI was developed with a little bit different of a baseline. He's kind of the forefather of SIRS, chronic inflammatory response syndrome. So he took about 800 of his patients that were sick and used their homes as kind of a baseline panel and determined, like you said, 5 molds. And actually, how they determined those, they took Stachybotrys and Chaetomium, which are like
the 2 big ones.
Yeah, the big guys.
Yeah.
And then the other 3, as I understand it, are also associated with illness and toxicity, but each of them require a different amount of water to thrive. So there's 3 categories of molds. Some require a less amount, some require a medium amount, some require a lot of moisture to really thrive. So he picked kind of some signature molds from each of those categories that he was probably seeing with his SIRS patients as well, and came up with the 5. So the HERTSMI 2 test is basically 5, and those 5 happen to come from the ERMI. There's overlap there. All 5 of them are on the ERMI.
So they don't, correct me if I'm wrong, but they don't run those against what they would call a good mold, right? In the HERTSMI.
No.
Just a raw score.
Yeah. So in that sense, I like it better.
Yeah.
you know, it is a little cheaper. That's why people go to the HERTSMI. But you can run into a risk of, you know, the home is a HERTSMI score shows, it's kind of like you were saying with Jeff Wright. The HERTSMI score shows that the house looks good, but then you take an ERMI and the house looks bad. And you do your visual and the house looks bad. So because it's only testing 5 molds, you run quite a risk of missing some mold.
Why can't there be a test called HERTSMI?
Ooh.
All right, we thought of that first out there, everybody. We thought of that first.
Helps me. It's in a test that would help you, not hurt you.
Not hurts me, helps me.
Yeah, I like that. So HERTSMI.
Next thing you know, someone's going to trademark that.
Yeah.
Helps
we
me.
need to come up with 6 words to match that now. So yeah, HERTSMI is good. The nice thing is, there's only like $100, $200 difference between the tests.
Yeah.
So if you're really wanting to do this style of DNA, you know, PCR test, I think it's worth probably doing the larger panel, you know, where you get the 36 molds, and then maybe not being so strict on using their scoring system. Yeah. Do you agree with that?
I absolutely agree with that. Yeah.
Maybe look at the raw data. Like, yeah, if the raw data says a bunch of stacky.
Yeah, if I got 50 spores of stacky in a small dust sample, I probably have an issue.
Yeah, regardless of whether the kind of the scoring says that it's fine or not.
Right.
And then the other thing, you can, Richie Shoemaker's website, if you want to take the raw data from the ERMI on those 5 molds that are on the HERTSMI, you can take that data from the ERMI, plug it into, there's a free like calculator on his website, I'm pretty sure. If not, you can Google it. And you just plug in the values, and it'll give you if you want an actual number, a HERTSMI number to tell you, you know, according to Shoemaker's system, you know, is this house, am I at risk of moving in or living in this house? So it's kind of you can get both tests in one if you just buy the ERMI and then plug the values into a calculator to calculate the HERTSMI.
And, you know, just to complicate the whole thing just a little bit more for everyone, just in the last few years, Dr. Shoemaker's kind of transitioned more into bacteria than mold or the HERTSMI anyway. So just throw that wrench in the machinery and
just to make it more complicated. Yeah, so I think that's a good overview. I'm trying to think if there's anything else that, I mean, this is kind of an introduction, but a little more depth than we went last time on some of these tests. Is there anything else you can think of, Mike, that we should mention about these 2 tests?
No, I don't think so. I think one thing you can glean from any of the studies or the research is that a good 50% of the homes out there have medium to high levels of mold.
Yeah.
And then 75% have what they would call, well, moderate to high levels of mold.
Yeah.
And you and I know just from doing inspections on enough homes, pretty much every home has some mold in it.
Yeah.
You can't get away from it. So.
Yeah, exactly. So I think in conclusion, what we kind of mentioned earlier, I think it can be a good tool, you know, but I think there's some big ifs, like we talked about some of them, because it is historical in nature. If someone just fixed and flipped that home, everything's new in there. You know, I mean, there's some variables there, and then you really have to be careful with interpreting the way they score it, I think. Yeah. And then you just can't replace good old, you know, having a good old inspector.
Yeah.
Someone you trust.
I can smell mold. I know where to look to see if they have a elevated mold load.
Yep.
That to me is worth more than any test you can throw out there.
Yeah. And someone who kind of understands the health aspects of mold. I mean, sometimes when someone fits the exact description of someone with SIRS or with mold illness, I mean, I start to look at the home a little differently and look in different ways and interpret the tests with that in mind. And so, yeah, I think you just always have to make sure you do good inspections with any tool.
Yeah, if anybody comes up with the silver bullet for testing a home,
yeah,
they're going to do well.
I know you have some ideas. We're not going to share them.
Yeah, we've got some ideas. Well, one of the biggest ideas is help me.
help me test. Yeah, I mean, we've talked about, creating different mold
Kind
tests.
of a hybrid test.
Many times.
Yeah.
And we always do come to this conclusion that, man, it is really hard to develop a test.
It really is.
That's going to be a silver
Yeah.
bullet, like you said. I mean,
Yeah.
every thought we've even come up with, we're like, there's the cons to that. There's the cons to that. And so I don't know if we'll ever come up with a perfect system.
Yeah.
But
Yeah, I'd rather concentrate on coming up with the perfect treatment.
yeah,
Yeah.
it helps me treatment.
Yeah. Okay.
All right. That's it for today. Thanks, guys.
Thanks, you guys.
Thanks for listening to the Mold Matters podcast. Be sure to subscribe for more in-depth information on mold illness and recovery.
Do you want to sign off again and dub it out of there? Or can you?
I don't know if it picked it up. You want to push it again?
Yeah, I'll just do it. Just don't say anything until it does it.
Okay.
And I can just crop it out.
Thanks for listening to the Mold Matters podcast. Be sure to subscribe. Thanks for listening to the Mold Matters podcast. Be sure to subscribe for more in-depth information on mold illness and recovery.